I would want to know your personal view. Having been work in healthcare industry for many, many years in many, many regions, countries, to what extent can Indonesia health tourism potential can compete with regional leaders such as Malaysia, Singapore, Thailand, and etc.?
Well, I think the potential is definitely there. All of us know, right, that the opportunity is very, very vast. Just take Malaysia, for example.
Yeah.
Population size, smaller, right? Several times smaller than Indonesia. Land size also smaller. But look at how they are moving ahead, advancing in healthcare, having opened up their country for medical tourism somewhat about 15 to 20 years ago. Now they're doing so well, and they're attracting many Indonesians to visit them, in fact, right? Especially in Penang.
Penang, yeah.
Yes, in Penang. So many Indonesians will go there, travel over.
Just for treatment?
Just for treatment and perhaps for health
medical
screening.
Medical checkups and
even
so
health
on.
Screening, even preventive health.
Yes.
People move to Penang to seek healthcare. While coming to Singapore, Singapore used to be the place to go for Indonesian outbound medical seekers.
Yeah,
just
true.
that economically, Singapore has risen in cost to a point that it's not as attractive as Malaysia at this point in time. Now, Indonesia has an opportunity here because there will be a gap between Malaysia and Singapore. So Malaysia, we know that the healthcare cost is relatively low compared to Indonesia, but their capacities are limited.
Yeah.
Right? Country is not as big as Indonesia, population not as big, healthcare facilities definitely not as numerous as Indonesia. So Indonesia can occupy that space between Malaysia and Singapore. And because Singapore is priced pretty high at a premium, it also inhibits some outbound travelers to go over. So I think there is an unserved population in Indonesia, right, who wants to travel out for healthcare, who wants to seek higher quality healthcare, but unable to access. And these are the ones that I think the Sanur Special Economic Zone could potentially serve for a start, right? And then later on, we can build upon the success and then start to target international medical tourists.
Yeah, well, wonderful perspective and insights. I would also want to know, in your perspective, what are the main challenges that Indonesia must overcome to become a competitive destination for international patients regarding what you said before? Yes.
Well, I think from a perspective of working here for about 1.5 years, I feel that there is still some fragmentation of healthcare standards within the country. And I think that is naturally a result of the size of the country and the way that the country is simply geographically distributed, right? We have to overcome these challenges. We need to improve the supply chain management, meaning that supplies generally are shipped into major cities. How do you ensure these supplies, consumables, drugs are also readily accessible in the rural parts of Indonesia? I think supply chain is one area that...
Supply chain.
Yes, I think we can definitely look into this. First, starting out with the Special Economic Zone, being able to bring in those that are not yet available in Indonesia. But I think learning the lessons of that new model of care that we are doing in Sanur, how does the country tap on these lessons to then allow the successes, mini successes in fact, I'm not saying it's huge, it's small successes, how do we then bring these small wins and convert them into big wins which will benefit the whole population? So I think supply chain is definitely one of them.
Supply chains in Indonesia because of its natural challenges, the geographical situation, archipelagic, and then the fast population that you have mentioned before. In your point of view, how do you think is the Indonesia's government support regarding this?
This is a project that is very special, as we all know. People have been talking about it for years, and there's so much significance behind it. And when I'm invited here as a global talent by both the investors and the government, I come here feeling very privileged and honored, and to be able to see and meet and talk face to face with so many politicians, so many business people who are supporting this project gives me a lot of confidence.
When was that?
over the last 1.5 years. So since I arrived last year in March within Bali, I've seen many of these people who are enthusiastically really behind us, right? Telling us that we need to succeed in this because this will be a game changer for Indonesian healthcare. And I think that if we are able to have a success in Sanur SEZ, the country will then be able to duplicate it in other healthcare theme SEZs. We know that this is not the only healthcare special economic zone. There are others in the pipeline. And being the first, we are really we have first mover advantage, but we also are the first to experience challenges and obstacles. And therefore, many of the other healthcare providers are looking at the Sanur SEZ and Bali International Hospital to pave the way forward, right? To be able to support the government to implement what the regulations have already indicated, to be able to convert vision into action.
Action.
Yes.
Right.
And not let it become inaction, not let it become just a dream. Right? A dream is good, but in order for it to materialize, you do need to have the right people,
right,
the right place, and the right time. And I think this is the moment.
And there is so much hope for the special economic zone, as President Prabowo said on June 2025 when he's doing the inaugurations.
Correct.
Right in your hospital.
Yes, exactly.